Imagine you're a nurse in a busy emergency department. You've settled your other patients and you go to a new patient's room that the triage nurse just brought back. She's sitting on the bed, kind of staring off into space. She looks disheveled. She's wringing her hands. You call her by your name that you saw on the chart and you ask, "How are you doing?" Nothing, no response. So you call her name again and ask, "Is there anything I can help you with? What's going on?" She finally looks up at you, locks eyes with you, and then you see her eyes widen with rage. She explodes off the bed, and before you can even react, she lands two punches to your neck and to your head, to your cheek. She grabs your scrub top and she starts pushing you out of the room, and she's yelling things that you can't even tell what they are. Spits flying. You don't know what's happening. You're like, man, this is out of control. So you regain some composure and you grab onto her and you start pushing back, like, I need to contain this. This is getting out of hand. I should, man, there's other patients around. I don't know what's going to happen. So you push back, you push her back into the room. And of course, in pushing her back, her legs connect with the gurney and she kind of falls back onto the gurney, and you try to control the top half of her body on to the gurney, and she manages to grab your arm and she pulls towards you, and then you feel her teeth biting into your wrist. You feel some pressure and it's starting to get pretty hard now, and you yell stop. You yell stop. She doesn't. So you take your free hand and you slap her on the face. It stops the bite for about 2 seconds or so, but then the bite is there again. This time it's harder. You yell at her stop, and you slap her again. And finally, this time she actually lets go. She lets go of your arm. And this time you've got techs, you've got security, you got fellow nurses coming into the room because they heard the commotion and they help control and restrain the patient. So the situation is done. The patient's taken care of. You go to the bathroom, you take a look in the mirror. You see red spots on your neck and on your face, starting to swell a little bit. You go get some ice, you put it on your face. You go and finish your shift. You write the incident report, you go home and you kind of decompress a little bit. The next day, the manager calls you and says that you're being put on paid administrative leave. Not because of the violent episode, but because of what you did. You left a red mark on the patient. That's abuse. Even a coworker said that you were too aggressive. And then 2 days later, HR calls you. You're terminated for patient abuse. Nobody heard your side of the story, only what you read in the report. 25 years as an emergency nurse in that one department. Done with a snap of a finger.